Good day, I am Arlene Salvador, third year student nurse from Nueva Ecija University of Science and Technology. Today I am going to perform a procedure of nasogastric tube feeding. The goal of this procedure is to improve every patient's nutritional intake and maintain their nutritional status. Assessment. Assess for the doctor's order because this procedure depends on the order of the doctor to avoid any problem and prevent harm. Next, assess for the client's level of consciousness and level of knowledge and understanding toward this procedure because a client has a right to know what feeding will be administered to him or her. Next, assess for the availability and functionality of needed materials. This is to make sure that the equipment is functioning properly before using it on the patient. Next, assess for any clinical signs of malnutrition or dehydration. This is to make sure that the nutrients given to the patient is enough. And last, assess for the allergies to any food in the feeding. If the client is lactose intolerant, check for the feeding tube formula. And notify primary care provider if any incompatibilities exist because allergies may cause harm and other complications to the patient. Planning. Before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feeding. Next, prepare equipment. Correct type and amount of feeding solution, 60 ml catheter tip syringe, a message basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label, or pre-filled bottle with a drip chamber, tubing, and the flow regulator clamp. Measuring container from which to for the feeding, if using open system. Water, 60 ml unless otherwise specified at room temperature, and feeding pump as required. Implementation. Prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort, but may cause feeling of fullness. In verifying the client's identity, there are many ways, using door tag names, wrist tags, and bedside name tags. Also, you can ask your patient directly for verification. Good day, ma'am. I am Arlene Salvador from NAUST, batch 2023, your student nurse for today. May I know your name, please?
Jillian.
Okay, ma'am Jillian, can I see your wristband? Okay, ma'am. Today, I will be performing nasogastric feeding on you to restore and maintain your nutritional status while you're having trouble swallowing food through your mouth. This procedure will not cause any discomfort, but you will feel a feeling of fullness. Is that okay with you, ma'am?
Yes.
Next, perform hand hygiene and observe appropriate control procedure to prevent the risk of transmission of microorganisms. Next, provide privacy for this procedure if the client desires it. Tube feeding are embarrassing for some people. You can close the curtains around the bed and close the door to the room if possible, but do not lock it to provide privacy for the patient. Next, assess the tube placement. Apply clean gloves. Next, attach the syringe to the open end of the tube and aspirate. Check for the pH. After that, allow 1 hour to elapse before testing the pH if the patient receive a medication. because medication can alter the result if you test the pH right away. Next, use pH meter rather than pH paper if the client is receiving a continuous feeding for more accurate result. Next, follow the agency protocol if the pH is equal to or greater than 6. pH level should be acidic or 1 to 5. That was an indication that the tube is on proper placement. Next, assess residual feeding. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. To assess the rate of gastric emptying. Next, administer the feeding. Before administering the feeding, check for the expiration date of the feeding. Because outdated formula may be contaminated and have reduced nutritional values. Next, warm the feeding to room temperature because excessively cold feeding may cause abdominal cramps. Next, clamping the feeding tube. Clamping the feeding tube before all the water is instilled because clamping prevents the air from entering the tube. Next, ensure the client comfortable and safety, securing the tubing to the client's gown. To minimizing pulling of the tube, thus preventing discomfort and dislodgement. And last, ask the clients to remain sitting upright in Fowler's position or in a slight elevated right lateral position for 30 minutes. These positions facilitate digestion and movement of the feeding from the stomach to the alimentary tract and prevent potential aspiration of feeding into the lungs. Evaluation. Evaluate the patient's response to the procedure. How's your feeling, ma'am?
I'm good.
Note that any discomfort feeling indicates wrong placement of the tube. And the presence of difficulty of breathing or gag reflex indicates aspiration. And last, document the procedure and other important data on the client's chart.